For every family in Rivers State, health is not just a service. It is security, it is dignity, it is hope. And at the heart of every community stands a place where this hope begins, the primary health center. Yet, for years, many of these centers struggled aging buildings, limited staff, inadequate equipment. For women, children, and families across the state, the journey to basic care was uncertain.
When labor was disturbing me, I want to come for delivery here. There was no nurse, no doctor, no light, nothing. Everywhere was just calm. So I got to go back to go and look for midwife to go to that because of no good care around the primary health care center.
Before, we used to go to Port Harcourt for health purposes. But since that one came there, we have been using it. And it's a very good one. At least it has been helping us. We don't go to Port Harcourt again, unless on a severe one, on a serious one that they cannot handle.
So I'll say what primary healthcare should represent for the average family, like you've asked. And what it should represent is the closest unit of quality healthcare that is accessible to every person, every family, every community in Rivers State. And that is at the core of the Health for All Rivers strategy of His Excellency Governor Fubara here in Rivers State.
This present primary healthcare center, now we have like lab. We don't stress ourselves much again to go outside as before to run tests and bring the report, the result of this test here. Now we can do tests here. There is a doctor, there is nurses. They come to work regularly every antenatal day.
The primary care system is very important in healthcare delivery, and this has been stressed as part of the current administration, President Bola Ahmed Tinubu's administration, to improve the healthcare starting from the basics. So we are really energized by the support of the government in this regard.
These visions set the state on a transformative journey, a revitalization effort that is bringing primary healthcare back to life.
Within the first 100 days of the governor's being in office as governor, revitalization work in conjunction with the National Primary Healthcare Development Agency had taken off, and about 10 within the first 100 days were revitalized. And these were primary healthcare centers across the 3 senatorial districts of the state. By the time we were marking a year in office, that number was now close to 40. And earlier this year, in conjunction with the World Bank, the revitalization, large-scale revitalization of 135 primary healthcare centers across the entire state was flagged off by the governor, represented by Her Excellency Professor Ngozi Maodo, the Deputy Governor. And so that brings the revitalization work to almost 200 as at now.
From improved delivery rooms to functional laboratories, from steady power supply to better staffing, each center is becoming a pillar of safe, reliable care for families.
Now, part of our revitalization is having solarization of all the facilities that we revitalize. So they will have at least 24-hour electricity, and that will also be a draw to increasing patient load in these facilities and patient usage.
I didn't give birth here because the place was not okay as of the time I was giving birth. But now it's very, very much okay for a pregnant woman to go. One, there is doctor there is constant light, and there are nurses on ground
that if a woman is on labor, people are there, the equipment are there. Now they have a scan doctor, and the place is okay.
Now we have solar power, which gives us light 24 hours. So, and that has greatly, made the facility like a light in the community. So people now tend to know, yes, something is going on in this facility. And by coming there, by coming here to the health facility, Model Primary Health Center Opobo, they find staffs are readily available, to render the services to the community. And that has increased the outpatient attendance. That has also, so to say, it has increased our delivery rates. It has increased the pregnant mothers coming to utilize antenatal care. So a lot of services have really, been on the increase.
For many women, the change is more than physical. It is emotional. It is the reassurance that when they walk through these doors, they and their children will receive the care they deserve.
For the past 10 years, this maternity here is unkept, very tattered and all the rest. Even the nurses there, actually the nurses ensured at that time, but not as now. Because now is more, there's a big difference now. Before, when you will go, they'll say, doctor no do, I better come back, doctor me this one no fit, that time oh. But now, anyhow, they go call doctor, you to go to hear for last week, and they call doctor to tell doctor go to give them directions, so see we go do.
Now, I can say everywhere is developed. Like, there's light, 247, there's light, there's nurses. When you come, you see doctor that will attend to you.
These are the stories that define the impact. One mother, one child, one family at a time. In many communities, the transformation is shared. The government builds and the people protect.
As a community leader, all we want to do is to protect it. We protected it so that hoodlums will not come and take it away from us again. So we are enjoying it, we enjoyed it, and we are still enjoying it.
Revitalization does not end with commissioning a building. It continues in the daily work of maintenance, staffing, and ensuring drugs never run out.
It gets to the heart of what the revitalization is all about. It's not just about brick and mortar, having fancy buildings, equipping them with shiny equipment, but what is it meant for? And it is so that you have a facility that the community trusts. When someone gets pregnant, first of all, they have the confidence to go to that facility and register for antenatal care services, so that early on, that whole process of risk finding out if it's a high risk pregnancy, eliminating or limiting the risk involved in that pregnancy, and ensuring safety of the delivery process and survival post-delivery is there. So for us, those are the metrics that are being used to assess the effectiveness of these facilities. The good thing is that with the buildings revitalized and the equipment in place and increased attendance into the facilities, what you mentioned about data is very important. We then start ensuring that we're capturing that increased interest, that increased attendance, the increased skill birth deliveries that are taking place in the facilities, and tracking mortality of both women, newborn, and infants as well.
We are very, very happy. Even when it comes to when it's antenatal day, if you see pregnant women, we pass 100. This place now is more, instead of some people, that time, majority people went for private hospitals because they take it as private is more better than the government. So majority people now are coming to there. They expect that instead of them to going for a private clinic, they are coming for this government clinic, and they know the doctor in question is doing his work. Even the nurses, they are trying their best on this facility presently now.
The revitalization of primary health care is not just a project. It is a promise that no mother should lose a child to preventable causes. A promise that every family deserves access to quality care close to home. As Rivers State strengthens the foundation of primary care, it lights a path towards a healthier future, one community at a time, one family at a time, one life at a time.